1 in 4 Americans are impacted by some form of mental health disorder, either themselves or with a family member or a loved one or a spouse. 1 in 4. Next up, our conversation with Robert Oakes, Executive Director of the California Mental Health Directors Association. Welcome.
Oh, thank you. Nice to be here.
1 in 4 people are affected by mental health issues. Do you think most people have any idea that it's that great a number?
Actually, I think they do. It's that a lot of people are reluctant to talk about it. And if you talk, for example, when I got this job, I took this job 6 months ago, and I was very worried because I've worked in the political world. I was worried that people, how do you advocate for people who don't have a voice?
Yeah.
But when I told all of my friends, a lot of people came to me and said, oh, let me tell you the story in my family, and let me tell you the story in my family. And I actually believe about half the families have lived experience, a family member or whatever. I actually believe it's probably 100% if you include substance abuse.
Well, and we talk as members of the gay community about coming out as being gay. I know from work that I've done with the Mental Health Association of San Francisco that when someone actually talks about a mental health issue in their family, whether it's depression or substance abuse or schizophrenia, it's like this sigh of relief. Oh my God, I'm not the only person. Do you find that's the case?
That is the case, and there's a lot of work being done on what they're calling social inclusion, which is getting people to talk about it and talk about the experience in their family and what it's done in their lives. And just because it can just wreak amazing havoc in a family life. And frequently, if you probe deep enough in a family, you'll find that there's some form of, everybody will experience a mental health issue. It's just like a physical ailment, and the brain is a physical part of the body.
Right.
But they will, it's not okay. Somehow we think it's a character flaw, it's a behavior, it's a strength thing, it's your own fault. And I don't know why something that happens in that part of your body is your own fault versus if you have diabetes or anything else. So it's just, everybody will have some mental health crises in their life. It's just a matter of the degree, and environment will affect it. But environment will affect your diabetes, your heart condition, your cancer rates. So it's not any different. It's just that we need to be honest and talk about it much more frequently.
Well, California has been an envelope pusher in so many ways. I mean, same-sex marriage, all kinds of issues. Is it pushing the envelope as far as helping remove stigma around mental health issues?
It actually is. Well, California a number of years ago passed a tax on individuals who earn $1 million or more a year. There's a 1% tax on anything over $1 million that they earn, and it generates a little over $1 billion a year. So we have a lot of high earners in the state, and that funds a lot of programs that we call innovation programs, so we're able to try out new things, and also prevention and early intervention, because we know that if you're able to prevent it in the first place, the costs are substantially lower, and if you do early intervention, the earlier you can intervene, the much more successful you'll be. 50% of all mental health crises, people with mental illness will present before they're 18 years old.
So we're talking about adolescents.
Adolescents, and 75% before they're 24.
So, I mean, I would imagine that there are some mental health issues that if it's a 12-year-old, a 13-year-old, a 15-year-old, maybe their parents just chalk up to being, well, my God, they're teenagers, they're difficult.
That's absolutely right, and a lot of times it's tied to poverty. It's tied to discrimination. If you're a child of a person of color in a poor family in an environment where there's a high rate of crime, if you're gay, lesbian, it just exponentially grows the risk that you're going to have to suffer.
Specifically about the LGBT community, I have read, and tell me if I'm right in this, that suicide rates, for instance, are greatly increased among LGBT youth, and that also there are a whole score of mental health issues that seem to just get ratcheted up in the percentages if you're a member of the LGBT community. Is that true?
That is true. It's true across all minority populations because of access to care, etc. In the juvenile world, they're about 3 times more likely to attempt suicide than a straight kid, but they're about 4 times more likely to succeed at suicide.
And is that because if you're an LGBT teen, maybe there's not someone standing there saying, don't do that?
Well, yeah. If you're African American or you're Asian or you're Latino, you're in an underrepresented population, you have a support network. You have family, you have other people who are at least like you. So even though you may be more subjected to mental health issues, but if you're a gay, lesbian kid and you come from a straight family, well, who do you go to? Who's going to understand? Who's going to reach out? It's getting much, much better, but we still have a lot of work to do. And any community is going to have these issues. I mean, I think when Proposition 8 passed, there was a lot of depression that occurred among gay people, because at the same time, chickens were approved to have bigger cages, but gay people couldn't get married. So, that has an impact. And I know that, the issues around Florida with the Stand Your Ground law, African Americans, you can track the increase in depression among African American males when they see that sort of thing happen.
Well, you lead me to my next question, which is, how political is all this? I mean, you're a political animal. I met you when you were working for San Francisco Mayor Frank Jordan. You went on then to work for California Governor Gray Davis. You're up in Sacramento. I mean, that is the business. It's politics. How political is mental health and the issues which are before the legislature, before the governor?
Well, it's interesting. We're in a really good place right now. The Affordable Care Act says that one of the 10 essential benefits is mental health care, so that will help reduce the stigma around mental health. And it's actually polling very well these days, and Californians in particular seem to be saying we shouldn't be locking everybody up. We ought to be looking at better ways to do this. And it doesn't have to do anything with compassion if you don't want it to be. Just economically, it costs us $60,000 a year to keep somebody in prison, and if we can deal with their mental health and their substance abuse issues outside of prison and prevent them from offending in the first place or reoffending, you're going to save a ton of taxpayer money.
Right, so do you come across a pushback when you deal with families or people who are dealing with mental health issues and you say, look, you know what, the way to get this law passed or the way to get the funding we need for this program isn't to talk about the fact that your son, your daughter, your wife, your husband needs that care, but it's going to be cheaper for those of us who are going to be paying for it if we do prevention.
Yeah, I think the first thing you talk about are the stories, just because the stories of recovery works. Everybody with the appropriate treatment will get better. They may not fully recover, but everybody will get better. And the stories work, and then the numbers simply bolster that. It's like you ought to do the right thing as well as the good thing. And that's what we try to encourage people to do.
All right. So now you've been in this position for 6 months.
Yes.
What have you learned?
I've learned that mental illness and substance abuse affects almost every family, that the ability to recover is amazing, that the stories are so inspiring. There was, just for example, just one woman was hospitalized 77 times, 77 times, psych emergency hospitalization. She got into a program through a full service partnership, which is sort of wrap around whatever it takes to help her. 0 times since she's been in that program.
Now, why did it take 77 times? Because she didn't know that there was help to ask for, or because she just fell through the net 77 times?
She fell through the net 77 times. You'll find a lot of dual diagnoses, substance abuse and mental illness, among people who are homeless, for example. And so then they're very expensive for social service arena. So, and this tax on individuals who earn $1 million or more a year, that helps fund these sorts of programs that other places don't have.
Now, in your work, do you advocate before the legislature? Do you go, I mean, you are the face of the California mental health world, in a sense. What is your main goal as Robert Oakes?
We advocate for the programs that counties provide for mental health in their community. So my main goal is to make sure that the funding and the services, the appropriate services, are in place in the counties so that people where they live get the services they need to improve their quality of life and the quality of life for their families.
In our last 30 seconds, tell me what you think is the biggest misconception about someone who has a mental illness.
That they're going to be dangerous to other people. Far and away, if anybody reaches that level of mental distress, they are far more likely to harm themselves than they are to harm somebody else.
And how effective is medication?
Medication with therapy is highly effective. There are people, there's a program in one place, for example, and there are many like this. The gentleman who runs the program suffers from schizophrenia. He probably would not like it if I said suffers, but he's diagnosed as schizophrenic. With medication, therapy, and
He can
daily
become a
work,
working member of society.
he is a very productive man. Has changed a lot of lives.
Thank you. We've been
Thank
speaking
you.
with Robert Oakes of the California Mental Health Directors Association. I'm David Perry. Thanks for watching. We'll see you next week on 10%.